I'm Natasha Anushri Anandaraja, and I'm a pediatric doctor and a public health practitioner, and I live in New York City.
Thank you so much. And can you tell us a little bit more of what you do and how has that impacted both you and the people you serve?
Sure, yes. So in a lot of my career, I've been working in countries that have less developed economies. And so working in very rural communities with women um, on maternal and child health programs. And as I did that in countries in East Africa and in Asia, I realized quickly that women were really held a lot of expertise and a lot of knowledge and a lot of intergenerational wisdom um, that could take their communities forward, but they weren't necessarily empowered to do that. And global health practitioners like myself had the money and the resources and the status and the privilege to be able to go into these communities to develop programs with the women that would uplift their communities and improve the health of their children. And then we had the ability to leave those communities and travel into other communities and transfer the knowledge of those women. And as this as I practiced this for years, for up to a decade, I realized that there was a very exploitative, extractive nature to this interaction, so that the people with privilege, such as myself, had the ability to transfer knowledge, but the women who were the experts, who were the holders of the knowledge, had no ability to stand up themselves as the leaders and the teachers and reach each other and connect with each other. And so I started an organization. It's called Women Together Global Incorporated. And we raise money and implement programs in East Africa. So far, we've worked in Mozambique and Malawi that enables women at the very grassroots community level to recognize the skills that they have to share, to develop themselves as educators, and to be able to travel outside of their village and meet other groups of women and directly share, to transfer income generating skills. So we have groups in Malawi and in Mozambique who have skills in creating improved cook stoves, creating alternate biofuels, economically sound baking and sewing projects, coffee growing, etc. And so we support them to travel outside of their communities, perhaps for the first and only time in their lives, to be able to meet other groups of women and transfer those skills, share those skills, and then build those skills into income generating activities in their communities. And in this way, the women gain independence because they're earning their own income, but also they get a real sense of themselves as being the leaders and providers and educators of their community. And it changes a whole social dynamic around the value of women in those communities.
Wow, that sounds like a project where definitely women are claiming the power that they have. And that's very exciting. Um, Anu, you were talking also about a little bit of some of the activism, some of other struggles you're involved with in this healthcare system. Can you tell us a little bit more about that?
Yes, absolutely. It's ironic that, you know, we often don't look in our own backyards because it's harder to look at ourselves than it is to look and see where problems lie outside of ourselves. So while I'm busy working on women's empowerment in Africa and Asia, in my own backyard in the Mount Sinai Health System, where I was employed as a pediatrician and a global health educator, I myself was the victim of extreme misogyny and discrimination and harassment on the basis of my sex and my race. And so right now, actually, myself and 7 other plaintiffs, 6 of them are women, are engaged in a federal lawsuit against Mount Sinai Health System in New York. It's a very large health system. It has, I think, 9 hospitals, several other clinics, employs around 45,000 people across the city of New York. And we have taken this on because we experienced discrimination and harassment on the basis of sex and race that had us completely devalued within the health system. We were demoted, our pay was less compared to men, we were treated badly in the workplace, our professional relationships were destroyed, we were gaslit, our work was unduly criticized, we took the blame for failed projects, all of the things that women experience all of the time in their places of work, but somehow this has become normalized. This is the air that we breathe. This level of gender discrimination is not recognized. So for instance, things like sexual assault and sexual coercion are in the public view. They're recognized as being criminal activities. You think about Harvey Weinstein, Bill Cosby, if someone is sexually assaulted, we know that that is an egregious event. But there's a pervasive undervaluing of women that occurs in the home, in the community, and in our workplaces, that it's hard for us to recognize the impact of that. And what it does in the healthcare system, where it is it's extremely significant. 80% of our healthcare workforce are women. So if 80% of our healthcare workforce are being treated as second-class citizens, as subhuman, as basically cattle to be used, discarded, abused, what do you think that does to the level of care that is available within the healthcare system? If female healthcare workers are denigrated, then female patients and minority patients are not going to be adequately cared for. And so, you know, we started as a group of plaintiffs, we decided that this level of discrimination and mistreatment within a health system could not go on. We knew that it wasn't new, that it was pervasive, but that it needed to be addressed. And so we came together, we put together the lawsuit, and we also formed a group called Equity Now at Mount Sinai. And what we do is we are advocating very loudly for better conditions for female and minority, gender minority and race minority health workers within the healthcare system, and hoping that we can use our case as an example of what needs to change. And so far, you know, we've held events, we've tried to give a platform for women's voices, we've held press conferences to raise public awareness, we've lobbied our elected officials, and we're actually very proud because we found some very strong partners within the New York City Council, and specifically within the Committee for Women and Gender Equity in the New York City Council, and we're able to work with them to pass a new piece of legislation for New York City, which will create an advisory board for race and gender equity in healthcare. And this advisory board will be made up of healthcare workers and healthcare students. So the people from the ground level, women and minority workers who really can understand the experience of being discriminated against day after day after day in this kind of environment, and make recommendations to the mayor of New York and the city council to make changes, to hold institutions accountable for treating their workers equitably.
Well, thank you so much for that. Well, definitely with what you have shared, it's a testament of how active you are in this struggle already. And what I wanted also to ask you is then what would be a message for other feminists in other localities to get involved like that, right? To fight this fight not only at the very personal level or like, you know, at your workplace, but actually also somewhere else as well.
Mm-hmm. I love what you said about not only personal, but also getting involved somewhere else. One of the things that we really kind of push is speak up where you are. Please start there. Because it's very hard to have the energy and the ability to impact a situation like this unless we're impacting it in our own lives. If we are going to speak up against oppression, it has to start with the personal. We have to be practicing every day. And I realized that with myself, with this whole kind of analogy of there's no point me fighting for women in Africa if I am not standing up in my own place of work and saying, this is wrong. And then that extends into if I'm on the bus and I see something going on, I have to say, this is wrong. And if I'm in my home facing my own family and I see something, I have to say, this is wrong. So we have to practice saying this is wrong and standing for something better in every single moment. and then get on social media, read the news, find out what is out there that sparks your motivation and your passion, and reach out. And what we have found is, since we started Equity Now, we get, Twitter DMs, and we get emails, and we get phone calls. All of those strengthen us to go forward. So we want to hear from other women who are saying, yes, 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 this is important, because that strengthens us. And then being able to create a base of women who we can call on for advocacy. We need you to call your city council member, quick. We need you to call your congressional rep, quick. We need your vote in this area on this. So being available, and I know there's a lot of bombardment right now with requests. Sign on to this permission, this petition, call this, do this. There's a lot of call for advocacy, especially in New York City, around gender and race and COVID and Black Lives Matter. But take the time to do some of that every single day. Like, put your energy behind those, pick up the phone, sign the petition, because for those of us who are organizing this, every single piece of support counts. And then if you have more energy to give than that, then write directly to organizers of events that you see that spark your interest and say, how can I help? Here is my skill set. Anything from, I'm very good at graphic design. We always need graphic design. We need a flyer to go out. We need, a social media piece. We need an Instagram post. List your skills. Say, I would be so happy to do this, 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 and this. I will balance your books. I can copy edit your documents. Offer a skill and see if it's taken up. But please, we need all hands on deck.
That's great. Wow. Thank you so much, Anu. Your message has been very informational, but also very inspiring. So we appreciate that. And yeah, so for the feminists to take notes, please.
We are together. Thank you very, very much.